Hi, I'm Dr. Shamah here. I'm here with my colleague, Dr. Isabella Bergagnini, from our obesity and endobariatric clinic on 85th Street.
So, Dr. Shamah, you have a few years of experience under your belt in the realm of endobariatrics. My question to you is when you regroup with your patients after they've recovered and lost weight 1 or even 2 years out, what is the main feedback they give you that prospective patients should know about that you feel compelled to share?
So my patients, when I see them in clinic and when we follow up, this is 1 year, even 6 months after, they all seem to mention of how hard it was after the procedure and how they wish they had put in more work during the process leading up to the procedure. Everyone kind of wants to get to the intervention. Everybody wants to get to the thing that they haven't tried yet that's going to help them lose weight. And they're really in a rush at the beginning to get to the endoscopic sleeve gastroplasty or the revision, because that's going to be the restriction that they want to feel that's going to help them, shift the balance of calorie intake to negative and help them lose weight. But what they don't understand is that if we do a lot of work before the procedure, we kind of eat in a more orderly fashion, we control our meals, we make our plates more variety, we eat cleaner proteins, more whole grains, we make the changes beforehand, that when we take the volume away, it really it really utilizes that restrictive, slower emptying volume to their advantage. And they really, really lose weight in a more controlled fashion. And it's easier because they've already made that switch in their mind. So that's the biggest feedback that I get. And the biggest advice that I can give to prospective patients is don't rush the process. The process is the process for a reason. We're not trying to slow you or weight loss. We're trying to help you understand how to make proper changes in your life, how to, focus on exercising and building muscles, increasing your metabolic rate, and really modify the modifiable factors that we can that lead to obesity. It makes the journey afterwards easier. It makes it more impactful and likely more durable. Those who rush in afterwards, it's harder and are less likely to keep that durable weight loss. So my biggest advice is slow the roll, enjoy the process, learn from it, and I think afterwards it'll be a much more impactful result. But everything takes its own time.